Lower blepharoplasty is a very common procedure that we do in patients, especially for anti-aging purposes. Hi, I'm Dr. Peter Lee, board-certified plastic surgeon here at Wave Plastic Surgery, a world's leading clinic. So what is a lower blepharoplasty? Lower blepharoplasty is a surgery that addresses three common things that most patients are seeking. A lot of patients, they use the term bags under the eyes or wrinkles around the eyes. And these are the things that we're targeting when we're doing a lower blepharoplasty. Bags under the eyes refer to the puffiness that occurs in the lower eyelid, and it occurs because of the herniation of fat in the lower eyelid. As we get older, it's not like as if we gain more fat in the lower eyelid. It's just that the tissue that's holding the fat in becomes a little bit loose, and therefore the orbital fat kind of like becomes much more prominent. So a lot of times what we're doing is that we're either removing the fat, or in some patients, we are doing what we call fat transposition, which means utilizing the fat that's popping out and moving that fat to fill in certain hollow region, especially just below that, what we call the tear trough region. The dark circle occurs in the lower eyelid for a variety of reasons. But for a lot of patients with bags under the eyes, it really is because of the shadow that it creates. When there's more fullness at the top, it creates more shadow just underneath that, and it causes that darkness. In some patients, however, it really is because that area is an area where the skin is the thinnest. And so in those patients that lack fat in that area, sometimes that it becomes translucent so that you can really see right through the skin and right on to that orbital bone. These are patients for the dark circle where fat transposition really helps, because not only does it remove that bag, but it also kind of like adds a little bit more volume just below the skin so that there really is a little bit more of cushion between the skin and the bone underneath that. And therefore, it kind of like hides that translucent darkness of the lower eyelid region. And for people with a lot of wrinkles in the lower eyelid, it does involve removing extra skin. That's what a lower eyelid surgery involves. Repositioning the fat or removing some of the fat, taking out some extra skin. And for a lot of patients now, whenever we take out the extra skin, we're doing what's known as a canthopexy, which means supporting the lower eyelid margin. Because if there's one thing we worry about with a lower eyelid surgery, is that if we remove a little bit too much skin, or if there's a little bit of too much tension, then sometimes the lower eyelid margin can become a little bit rounded. And therefore, what we do is that we kind of tighten the end of the lower eyelid margin so that it preserves that tightness. And so it doesn't change really the lower eyelid margin at all, but it just kind of preserves that. So who are good candidates for lower blepharoplasty? Lower eyelid surgery is ideal for patients who feel like their lower eyelid area looks tired. For a lot of people, they can't really identify exactly what the problem is, but they understand that their lower eyelid looks tired because of either puffiness, because of the bag under the eyes, or they're starting to see that dark circle underneath the eyes. And so these are the great patients to actually do lower eyelid surgery on, to not really just address whether somebody looks younger or older, but really to kind of alleviate some of that tired look. What to expect before, during, and after lower eyelid surgery. So prior to the surgery, there is an in-depth conversation regarding what that surgery involves. If somebody's actually a little bit younger, who doesn't have a whole lot of wrinkles in the lower eyelid, then it really is just about manipulating the fat. And if that is the case, then we can do everything from internal incision, which means we make an incision internally so there's no external scars, and we can either remove the fat or we can reposition the fat. And in those patients, the recovery time is really quick. Usually in about 7 to 10 days, you're pretty good. And because there's no external scars, there are no sutures to remove. A lot of times we are doing these type of surgeries under twilight sleep or IV sedation with local anesthesia, which means we give a little bit of medication through the IV to kind of relax them and then do everything under local anesthesia. The surgical time for something like this is usually about 45 minutes to an hour. For those patients that require skin removal because of wrinkles as well, then we are making an incision just below the eyelashes, and we're taking some of the fat out, or we are repositioning the fat, but also we are removing a little bit of extra skin. After the lower eyelid surgery, we typically see patients 7 days later to remove the sutures and also assess how they're doing. Depending upon how they are, we sometimes do see them 1 month later and sometimes 3 months later to see the final outcome. Lower eyelid procedure is one of the most common procedures that we do here at Wave Plastic Surgery. It really addresses a lot of concerns about looking tired. For more information on this procedure, please visit worldsleadingclinics.com.